So what if I told you that one of the most powerful tools we have to fight a global pandemic isn't a new medicine or a vaccine, but actually a country's legal code? I know it sounds a little out there, right? But the data tells this incredible story about how the laws we write can either be our greatest ally or our worst enemy in the fight for public health.
So let's just start with the big question. Can a law, literally just words on paper, actually make a pandemic worse? Well, all the evidence we have points to a huge, resounding yes.
You see, when it comes to health, countries basically take one of two paths. On one side, you've got what are called punitive laws. These are the ones that criminalize certain behaviors. And what they end up doing is creating a lot of fear and stigma, which, you can imagine, drives the people who need help the most into the shadows, far away from health services. But then, on the other side, you've got protective laws. These are designed to do the exact opposite. They uphold human rights, fight discrimination, and really build an environment where people feel safe and even encouraged to get testing and treatment.
Okay, so does this choice of legal framework actually make a real difference on the ground? Well, a massive global study, and I mean massive, we're talking 194 countries set out to answer that exact question. And what they found, it's pretty staggering.
So let's just dig right into the numbers. The study found that in countries that criminalize same-sex relationships, there is an 11% drop in the number of people with HIV who even know their status. Think about that. That's a huge hole in the very first line of defense against the virus.
And, the impact doesn't stop there. In those very same countries, viral suppression, which is just the medical term for the virus being controlled by treatment, is 8% lower. So the law itself is creating a measurable negative health outcome. It's making people sicker.
And this pattern is just so consistent. When you look at countries where personal drug use is criminalized, health outcomes drop by a staggering 14% for both knowing your status and getting the virus under control.
But here's the crucial part, and it's the good news in all of this. The reverse is also true. The study found that countries with those protective laws we talked about, things like non-discrimination laws or laws against gender-based violence, they all show significantly better HIV outcomes. So it's not just about avoiding harm, it's about actively creating health.
Okay, theory is one thing. Let's dive into this and see how it actually works in the real world. We're going to zoom in on one country, Sri Lanka, and a fascinating public health puzzle that really brings all this global data to life.
By almost any measure, Sri Lanka is a public health powerhouse. It has a high Human Development Index, and it's been certified by the World Health Organization for eliminating mother-to-child transmission of HIV and syphilis, and malaria. I mean, these are incredible hard-won achievements. And right here, here's the paradox. Despite all of this amazing success, Sri Lanka's own national data shows that the number of new HIV infections has been on a steady upward climb. So, what in the world is going on?
To solve this mystery, we have to look a lot closer at the data. See, the answer isn't really in what is happening, but in who it's happening to.
The epidemic is getting younger. New diagnoses are absolutely spiking among 15 to 24-year-olds, and get this, it's overwhelmingly young men, who now make up a shocking 92% of all new cases in that age group. So you might be thinking, is a problem inside the clinics? Well, not entirely. A 2023 study of doctors in Sri Lanka found that nearly 95% had good, positive attitudes towards sexual and gender minority people. But, and this is such a key detail, it also found a strong link between higher self-perceived religiosity and having negative attitudes. This tells us that even inside a system that's broadly supportive, these pockets of stigma can create very real barriers to people getting care.
So, how do you tackle a trend like this? How do you connect that huge global data we saw about law and health to the specific, complex reality on the ground in a place like Sri Lanka?
Well, as it turns out, the most powerful piece of evidence, the clue that really unlocks this entire puzzle, it doesn't come from some international study. It comes directly from Sri Lanka's own public health experts.
This right here, this is a direct quote from the country's official national strategic plan for HIV. This is their guiding document, their roadmap. And their own top-level plan is explicitly drawing attention on the need to repeal the laws that criminalize same-sex relationships. They've identified the law itself as a direct barrier to public health.
And you can see why this connection is so incredibly important. These punitive laws, they create fear and stigma. That fear prevents the very people who are most at risk, like those young men we saw in the data, from even thinking about getting tested. And of course, when HIV goes untested and untreated, it spreads. all of this makes repealing that law not just a political act, but a direct, evidence-based public health intervention.
Now, the story of Sri Lanka isn't just about one country. It's bigger than that. It gives us a universal lesson, a kind of blueprint for how we should approach health and law everywhere.
And the blueprint is actually pretty simple. Step 1, you remove the punitive laws that create stigma and drive people underground. Step 2, you enact protective laws that encourage people to seek care. And the result, step 3, is better health outcomes for absolutely everyone.
And that brings us right to the core takeaway from all of this. Law reform is not some separate issue from healthcare. It isn't just about politics or even just about human rights, as critical as those things are. It is a powerful, evidence-based tool that belongs right in our public health toolkit.
Which leaves us with one final thought to chew on. If rewriting a law can be as effective for public health as developing a new medical treatment, well, it really makes you wonder, what other major health challenges could we fix?